I have plantar fasciitis. What do? I wake up in the morning, my feet on the bottom are killing me. I get up and just creep to the bathroom. It's just awful. Can barely walk. It's better a little bit during the day. It's better with exercise, but the feet are just awful. So what is plantar fasciitis? Plantar fasciitis is an inflammation of the fibrous tissue on the bottom of the foot. It involves inflammation of this big, thick band of tissue that runs across the bottom of the foot that connects the heel bone to the toes. I used to be a marathoner. I ran, believe it or not, 4 marathons, about 20 half marathons, and I had plantar fasciitis for over a year. Very common in people that run. The symptoms are very similar to what I had. I would wake up in the morning with a stabbing, severe pain. I'm like most men, I get up and go straight to the bathroom. I would just creep to the bathroom. It's very common in runners like me. It's very common in people who are obese. It's very common in factory workers, people who walk on these concrete floors all the time and are on their feet all the time. It's common in people they're both flat-footed and high arches. It's definitely worse right after exercise, but exercise seems to be okay. You're able to run, but it's just worse afterwards. So what's the treatment? Well, there are a lot of different treatments, and I'll tell you what worked for me because I think it's really the only thing that works long term. But rest helps, and you must ice and stretch. Take anti-inflammatories, physical therapy. Sometimes these night splints, they put them on your feet and it dorsiflex your ankles. I had trouble sleeping in them. Definitely, orthotics, and you can get some expensive ones, or there's some good orthotics that you can buy, on Amazon. Injections and rarely surgery. We really try to avoid surgery. Sometimes PRP or Tenex therapy through the orthopedics helps. PXP, where they draw your blood and spin off all the plasma and spin off all the platelets and re-inject it. It can take forever to get better. So what do? You can talk about this all day long. You can take anti-inflammatories, you can rest all day long, but if you don't follow a stretching protocol, it will never get better. This is what I did. I had one of these yoga straps. You can use a rope or a beach towel, sit in my recliner, and I would put it under my foot and just pull my foot up. And then I would ice. I'd get 2 frozen water bottles and I'd just push them on the bottom of my foot till it just killed me. And then I would put my feet on 2-gallon Glad bags full of ice and rest. The other thing I would do is I would get on the first step and just, put my heel down almost on the floor. So it's a really, really good way to stretch. So icing, stretching, anti-inflammatories, more icing, more stretching. You got to do it a couple times a day. Ultra marathoners, sometimes they'll have this for years, and nobody likes to stretch. But if you don't stretch daily, expect no improvement. This is Dr. Caldwell Miller, the Brain Doctor. Like, comment, subscribe. Now I answer every single comment. It can take 1 to 3 days, but I answer every single comment. More later.